An overview of Laboratory Quality Control Program. What is QC program? Quality control, that is QC, is the daily process designed to ensure that a test system works properly. It is a series of practices carried out for each test on each day that patient tests are performed. The process consists of analyzing specimens of known concentration, carefully recording and interpreting these values against the set acceptability criteria before releasing patients' results. Quality control testing helps to detect instability or other problems in the laboratory's testing system that could render patient results invalid. It also helps to identify opportunities for system improvement in the analytic phase of testing. Corrective and preventive actions based on quality control data will help to ensure patient test results are medically useful. A quality control program should be designed to recognize current problems as well as developing issues that could affect patient test results, detect immediate errors that occur due to test system failure, adverse environmental conditions, and operator performance. Monitor over time the accuracy and precision of test performance that may be influenced by changes in test system performance, environmental conditions, and variance in operator performance. For quantitative assays, at least 2 levels of control materials should be tested every day of patient testing. A positive and negative control should be tested every day of patient testing for qualitative procedures. The laboratory can also develop an individualized quality control plan, that is, IQCP. Emphasis should be placed on evaluating patient results surrounding clinical decision concentrations. Quality control testing should be rotated among personnel who perform patient testing. Control materials should be tested the same way patient samples are analyzed. This is important to address variables in technique that may influence quality control ranges and impact patient testing. If a laboratory has several analyzers, quality control must be performed on all analyzers for all analytes on each day they are used for patient testing. Choosing appropriate control materials. Commercial control materials, if available, are generally used to monitor the quality of tests. There are several criteria to be considered when selecting quality control materials. The control materials should behave in a manner similar to patient specimens, have assay values within clinically significant ranges and decision concentrations, fall within the analytical measurement range, that is AMR, have minimal vial-to-vial variability, be stable for long periods of time in large enough quantities to store for appropriate lengths of time, preferably a year, and be unique from the calibration material. Assayed and unassayed controls. Assayed controls, the analyte target values and ranges are specified in the manufacturer's product inserts. The assigned values must be verified in the laboratory. Unassayed controls. The manufacturer lists the analytes that are present in the control material, but does not define acceptable ranges. The target ranges for this control must be established empirically by analysis in the laboratory. Monitoring quality control. Monitoring analytic quality through the use of control materials involves the following: establishing target values and ranges, that is, mean and standard deviation. Evaluating the control data based on the established limits. Initiating and documenting appropriate actions when controls exceed the acceptable limits. When new lots of control materials are first put into use, the process that is needed to establish or validate the target values is dependent on whether the control are assayed or unassayed. Setting the control range. After collecting daily quality control data, the lab should establish the control range based on the calculations of the mean and standard deviation. The mean is an estimate of the central tendency of the distribution of control values, assuming system performance remains stable. It is a reflection of accuracy while standard deviation, that is SD, is a reflection of imprecision. Usually, laboratories set their acceptability criteria using the standard deviation of plus or minus 2. It is advisable to recalculate the mean and standard deviation each month as data is added from previous months. These cumulative or lot-to-date means and standard deviations are used to update control ranges. This gives a more representative picture of long-term test performance. Reviewing quality control. Once you have chosen controls, know how frequently to run controls, and have rules to assess controls, then your next step is to define how you will review your quality control data. Daily quality control review. Quality control data should be organized and presented so that it can be evaluated daily by the testing personnel or supervisory staff to detect trends, shifts, or other problems. Patients' test results should not be released if the quality control does not pass the set acceptability criteria. Monthly review. Quality control data must be reviewed by the laboratory director, technical consultant, or other designated technical supervisor. Quality control review should include all the following: a review of statistical data, that is, for quantitative procedures. A review of quality control charts, checking for shifts or trends in the control values, that is, for quantitative procedures. Verification that appropriate corrective action was taken whenever testing personnel obtained data outside of acceptable quality control ranges. Recommendations for remedial action and documentation that the monthly review has occurred. Implementing corrective action. After determining that one or more controls fail their pre-established control rules, the operator should review the quality control data to aid in correcting the problem. Steps involved in conducting a failed quality control root cause may follow this protocol. Determine the type of error, that is, random or systematic. Consider the potential causes of the error identified. Perform an investigation applicable to the problem-solving technique, that is 5 whys, causal tree, fishbone, and etc. to determine root cause and develop corrective actions appropriate to the event.